patients with tumours within their liver come from lots of areas, so their primary tumour can come from outside the liver or can develop within the liver. But wherever it's come from, the first thing we think about is, can we cure that patient? And to cure them, we normally need to remove the tumour. That normally involves surgery. Sometimes we can destroy tumours within the liver using what we call the ablative technologies. That's where we put probes into the tumours and destroy the area of liver. If we feel that we can't remove the tumour safely, then we think about how we can arrest the growth of the tumours and make those tumours to shrink. Now, we conventionally have used what we call systemic chemotherapy. Those are drugs you inject into a vein. They're drugs that work because tumours are more sensitive to the drugs than healthy tissue. So that's been the mainstay of our treatment over the last 20 or 30 years. What I'm focused on is liver-directed therapies. These are therapies where, rather than targeting the whole body, we actually target the liver itself and isolate the liver from the rest of the body and focus our treatment there, because that's where the problem is, that's where the tumour is. And then we can use different techniques to effectively overpower the tumours or to destroy the tumours. Whether that be isolating the liver and giving a very high localized dose of chemotherapy, whether it's injecting particles which contain chemotherapy, or even radioactive particles which destroy tumours by nature of the very large radiation dose that we deposit within the liver. But the one asset I have is the fact the liver has this dual blood supply. It has a blood supply from the portal vein. That's the vein that comes back from the gut with effectively the nutrients and what the body would see as the goodies in it. The liver artery is actually a very small blood vessel, not a big deal for healthy liver, but liver tumours derive their whole blood supply from that artery. So if we go into that artery, we have the big asset that we can effectively damage tumours, but be careful that we can preserve healthy liver function, which is what we're after.